we're back, and we're going to do a quick little primer on breathing assessment, something that's kind of been repopularized in the last couple of years, is the importance of breathing, specifically diaphragmatic breathing. When your client is in a seated position, this is a great way to assess their breathing pattern. And there's a test I've learned through my training in neuromuscular therapy from guys like Untitled and Dr. Craig Liebenson called the high-low test. And basically what that means is you're going to have your client put one hand up high on their chest, one hand down low on their abdomen. And you don't want to coach them through it. You just want to see kind of what their natural pattern is. And just tell them, just give me some good breaths here, a little bit bigger than normal. And you're sort of watching them. Of course, Brett knows all about diaphragmatic breathing, so he's kind of informed here. And what you're looking at, what I'm looking for here, as the coach or assessor, is which hand is moving first or at all. What you're going to see on most people is you're going to see this move first, followed by this, or you're going to see very little to no motion happen down here at the abdomen, and it's going to all be up here, in this upper chest thoracic breathing pattern, which means that they're not using the diaphragm, which is the primary breathing muscle under the rib cage. They're not using it enough. It's not that it doesn't work. It's just a habit. And what's also happening is they're going to be overusing the trapezius muscles here. So if you were to actually palpate, kind of exaggerate for me, Brett, as you can, is you might actually see something like this. If someone kind of walks around like that, that's called Gothic Shoulders. And that's pretty indicative that they have a pretty poor breathing pattern, which is, this type of breathing pattern is associated with a lot of tension, chronic headaches, tension headaches, maybe even jaw pain, a lot of referrals from these muscles kind of can wrap around into the forehead, into the eyes. This sternocleidomastoid muscle right here is going to be overly used. The scalene muscles, the levator scapula, even some of these rib muscles are going to be way overusing these for breathing. So this is a very quick test, doesn't take long, but it really gives you an idea as to what their preferential breathing pattern is. It's called the high-low test. If you're not doing it or something similar, I highly recommend that you put this into your assessment plan.